Now the big thing with the massage, okay, is especially in sport, is we don't necessarily need to have, you know, I remember when I was doing all my courses, effleurage and petrissage and all these different names, but actually all we need to have is maybe our hands, whether it's our thumb, to do a little bit of work, but also my forearm can be very, very valuable to the therapist, and it'll save my hands doing a lot of the hard work, okay? So in terms of body position, you know, they may say in courses, okay, it needs to be this height, this height, and this height, but the key thing for me is using my body weight to get a good enough force through the tissue so that I don't have to work excessively hard. So what I like to do is do some kind of lunge, okay, through the tissue. So if I'm using Pete's anterior thigh hair, for example, if I was to spend a bit of time trying to change the tone hair, getting some kind of modulation in symptoms, then all I'm going to do is I'm going to put my hand here, I'm going to sink into the tissue, and I'm just going to have my forearm do all the work here. Okay, so you can see here in this position, I'm setting myself up in a lunge position, and as I come through, all the weight is going to be on the front foot. So I'm essentially doing a lunge as I go through it. So the forces are predominantly being taken from the foot as I use my body weight to come through my forearm. Now in this particular scenario, I feel like I'm reaching a little bit too low. So I've just put the bed up, okay, it's about mid quad level here, and I'm pretty comfortable here, and I can just spread my weight from my back foot to my front foot, okay? So as I go through the tissue here, I sink into the tissue, and then I'm just gonna come through like that. So it's very, very easy for me here. I'm not having to work hard. I'm almost leaning my body weight through this forearm, okay? And some of my weight's been accepted by the leg, and I'm just lunging through, okay? So I'm just gonna stroke through, I'm gonna lunge, I'm gonna put most of my weight through the forearm, and then as I come through here, then the rest of my weight is being accepted from my foot, and I'm going to come back again, okay? I might put my hand here sometimes for a balance, but then I'm just sinking into the tissue, getting my appropriate depth, and then I'm just coming through, and then I'm accepting weight onto the leg. So I'm almost pushing my body weight through the tissue, and it's very, very easy for me. So if I had to do this for a few patients, I could probably do this for quite a while, as opposed to, you know, using my hands and all this, okay? So the forearm, very, very useful in terms of getting a lot of the tissue, to try to get a lot of modulation, sinking into the tissue and going through it, okay? Now obviously I would use oil here, okay? And we'll cover that in the next section, but that's the big thing here, is getting the body position right so you feel strong, so you can push through. Now if I choose to use my hands here, it's the same kind of concept. I'm coming through the tissue. I'm not just using my hands and shoulders all the time, so I'm using a full body movement to protect myself, and essentially it's a lunge of some sort. So that's whether it's with the fingers or whether it's with the forearm, I'm almost lunging through, okay, and I'm absorbing the majority of the forces through my midfoot there as I come through, okay? And as I go through here, okay, and then you can position the athlete as and when you need it, okay? So getting your positioning right, you being in a strong position so you can use your full body weight, is very, very important, because there will be athletes where we will need to maybe do some deep tissue work, and especially if you're quite petite in relationship to the actual athlete size, that's when then it doesn't necessarily matter what you weigh or how big you are, but if you can use your body weight to the best of its ability, that's, from what I kind of seen from experience, the best therapists, and especially the best students that we've had on placement, the ones that can use their body weight to the best of their ability will always tend to get the best results, whether it's depth, whether it's making that significant change, okay? So just to summarize, body position, it's a full body movement, whether you're using your hands, whether you're using your forearms. We don't need to get too fancy with all these technical names. All we're trying to do is we're trying to put a force through the tissue to bring about some type of dermoneuromodulation, okay? Whether that's a change in the tone of the tissue, whether it's a decreased perceived threat, so the system takes away this protective tone and that allows an increased range of movement, or whether we bring some kind of change in the pain perception. Okay, so as always, we need to understand the tissue that we're influencing, but also we need to understand that we may not necessarily be actually changing anything physical to the tissue. Okay, so for the majority of it, the literature is suggesting that the majority of changes is from modulation from the higher centers.